Thank you for coming out to today's press conference. My name is Chris Smith. I've been a congressman for 34 years. Chairman of the Human Rights Committee, of the Foreign Affairs Committee, it's Africa, Global Health, Global Human Rights. I'm also chairman of the China co-chairman of the China Commission and the Helsinki Commission. And of particularly importance, I think, for today, I'm chairman of the Congressional Pro-Life Caucus, along with Dan Lipinski, who's a Democrat, co-chair with me. On September 9, 2009, President Obama told lawmakers and the American public in a specially called joint session of Congress on health care reform, right behind us, on the floor of the House, that, and I quote him here, under our plan, no federal dollars will be used to fund abortion, close quote. In an 11th hour ploy to garner a remnant pro-life congressional group of Democrats that were needed for passage of Obamacare, the president issued an executive order on March 24th, 2010, that said, and I quote, "The Act maintains current Hyde Amendment restrictions governing abortion policy and extends those restrictions to newly created health insurance exchanges," close quote. Turns out that those ironclad promises made by the President of the United States himself are absolutely untrue. It ranks right up there with President Obama's oft-stated deception that if you like your health care insurance plan, you can keep it. The PolitiFacts 2013 Lie of the Year. As many of you know, at its core, the Hyde Amendment has two indisputable parts. It prohibits funding for abortion and funding for insurance plans, any insurance plan, that includes abortion except in the cases of rape, incest, or to save the life of the mother. Obamacare therefore violates Hyde by funding insurance plans that pay for abortion on demand. Despite an appalling degree of non-transparency and obfuscation by the administration, an extensive audit by the General Accountability Office found in September that 1,036 Obamacare exchange plans covered elective abortion. GAO also found that separate billing of the abortion surcharge, as it's called, required by the Act, is not being enforced, and that the abortion funding premium is again in 2015 being illegally rolled out in the total cost of the plan. Healthcare consumers are therefore buying health insurance with little or no knowledge that they are purchasing abortion subsidizing plans. When it comes to public funding for abortion, the new 2015 open season enrollment is at least as bad and probably worse than last year. Again, President Obama's solemn promise not to fund abortion on demand continues to be broken with impunity. And once again, healthcare consumers are almost clueless as to which plans fund abortion and which do not. That is why ObamacareAbortion.com is an extremely useful new tool for healthcare consumers. And of course, this has been created by the Family Research Council and the Charlotte Lozier Institute. The Obama administration's cover-up of abortion insurance plans on the exchange is unnecessary, unacceptable, and absolutely unconscionable. Consumers have a right to know. Abortion is not health care. It dismembers and chemically poisons defenseless unborn children, and it hurts women. I would note parenthetically that last January, the House of Representatives passed H.R. 7, the No Taxpayer Funding for Abortion Act, and the Abortion Insurance Full Disclosure Act, which would end public funding for abortion in 2015, while alerting health consumers to concerning the 2014 plans, which funded and which did not fund abortion. Obama promised a veto, sadly, and the Senate hasn't even taken up the measure so that members could vote their will up or down. This website will inform, it'll motivate people to choose the right plans, and I want to congratulate the Lozier Institute as well as the Family Research Council for having the wisdom to create. Thank you.
Good afternoon. By launching ObamacareAbortion.com, we are attempting to do what the Obama administration has not been willing or able to do for the 2015 new enrollment. That is, to inform Americans about abortion coverage in Obamacare plans and expose the great difficulty in obtaining this information. As in 2014, the Obamacare exchange plans lack transparency, often lack abortion-free plans, and continue to fund coverage of elective abortion with our taxpayer money. My name is Arina Grossu. I am the director of the Center for Human Dignity with the Family Research Council. The Family Research Council and Charlotte Lozier Institute have done extensive research and are proud to launch our findings. It is not right that the Assured Health and First Care health plans in Texas would not give us a link to the internal document which they were obtaining, which they gave for the information, saying that they were not allowed to release it to the public. It is not right that after multiple phone calls to United Healthcare of Rhode Island, we still don't know if they cover abortion on demand because they were transferring us to the Medicaid and Medicare offices. It is not right that the Colorado Health Op is misinforming people that their two multi-state plans are only for federal employees. This is no transparency at work. Jonathan Gruber was right, and his comments confirm what we knew about Obamacare all along. People living in Hawaii, New Jersey, Rhode Island, and Vermont will most likely not have one single pro-life plan to choose from. In addition, people in California, Massachusetts, New York, Oregon, and Washington will have to wade through plans where most likely 90% of the plans offered will cover elective abortion. So much for choice. People who sign up for plans with abortion on demand are paying for other people's abortions under that plan because of the abortion surcharge. Everyone, and I mean everyone, in all 50 states is being forced to subsidize elective abortions with taxpayer funds to the beat of $855 billion in the next 10 years. So much for no taxpayer funding of abortion. Because Obamacare violates the principles of the Hyde Amendment on subsidizing abortion, and because Obamacare lacks transparency for Americans, Congress must enact the Abortion Insurance Full Disclosure Act and the No Taxpayer Funding for Abortion Act. The new Senate offers hope that these bills could become law. Now is the time. Let's do this.
Thank you. Good afternoon. My name is Genevieve Plaster, and I'm a research assistant for the Charlotte Lozier Institute. As we heard in 2009, President Obama did make a promise to the American people that under our plan, no federal dollars would be used to fund abortions. Here we are, 5 years later, dealing with the exact opposite situation. 2 months ago, the Government Accountability Office confirmed that taxpayer funding of elective abortion was occurring under Obamacare. More than 1,000 exchange plans nationwide, 1,036 to be exact, cover elective abortion and are eligible for federal tax subsidies, representing a major break from the long-standing principle of the Hyde Amendment. For 2014 enrollment, of the 5.4 million Americans who bought insurance through the exchanges, 87% used federal subsidies to pay for their plans, many of which cover elective abortion. For 2015, our team has already found one insurance company that has changed over all of its individual exchange plans to now cover elective abortion. Not only is there taxpayer funding of elective abortion, the current administration and Department of Health and Human Services seem to have made no effort to enforce transparency in the exchanges and with insurance carriers about abortion. The Charlotte Lozier Institute has been researching health insurance plans in the Obamacare exchanges since day one in October of 2013. My experience since then has been racked with challenges. In general, first-line insurance company responders were not provided any or accurate abortion coverage information to share with consumers. Most summaries of benefits and coverage that former HHS Secretary Kathleen Sebelius repeatedly pointed to for answers were completely silent on abortion coverage. I was referred back and forth on phone calls within insurance departments and between companies and the exchanges themselves, sometimes to no avail. One email I received reads on their abortion policy, and I quote, "This benefit is not listed on any of our sales documentations. However, it will be outlined in your policy. Unfortunately, our policy documents are not made available to the public. Once an individual is enrolled in our health plan, they receive a policy outlining the benefits specific to that plan." It's noteworthy that last year, the District of Columbia's exchange posted a frequently asked question about the insurance plans that did and did not cover elective abortion, naming each one. Though this approach could have been easily suggested to and duplicated by other state exchanges, it has not been. In fact, this very question that was on DC HealthLink's page originally is now completely missing from their DC HealthLink since at least September of this year and maybe earlier. This is not just a matter of improving customer service. It is a matter of federal legislation that forces Americans to purchase health care that may cover abortion on demand, to which many conscientiously object. And the exchanges or carriers are not disclosing this information consistently or at all before that purchase occurs, affecting millions of pro-life Americans. Our new website, ObamacareAbortion.com, seeks to provide this transparency that is so lacking on abortion coverage. Though it's not a permanent solution to taxpayer funding of abortion in Obamacare, Americans can use this tool to make informed, short-term decisions about their health care according to their conscience. Thank you.
Come closer.
Good afternoon. Thank you all so much for being here. My name is Kerri Kupec, and I am the Legal Communications Director and Attorney with Alliance Defending Freedom. As has already been noted, it is truly a tragic day in this country when Americans are forced to pay for abortion on demand. Americans who value and cherish life being forced and lied to by the government to pay for the abortions of others. I'd like to share with you a story of one family in Connecticut who has been specifically affected by this deception. The man's name is Barth Gracie. He lives with his wife Abby in Connecticut. They have 4 little children. About a year ago, Barth was informed by his insurance carrier that they would no longer have their plan come this fall due to requirements under Obamacare. His plan had been effectively canceled. Barth began to do a little research, some investigating into what his option would be under the new state health exchanges. And after much research, phone calls, and a very thorough investigation, it became apparent to him that all plans in the Connecticut State Health Exchange would include a secret abortion surcharge, a fee that would be used to fund abortion on demands for essentially anyone and everyone. Well, this was a big problem for Barth, and there were 2 reasons for that. For starters, Barth and his family are devout Roman Catholics. To take the life of innocent, preborn human beings would be an absolute violation to his conscience and his faith. But what was particularly ironic in this situation is that Barth also was the Rhode Island director for Right to Life, which if any of you are familiar with that organization, is one of the largest pro-life organizations in this country. This means that the man who had devoted his life to protecting the preborn, to lending his voice to those who couldn't, was now going to be forced by the Obama administration to fund the very thing that he was fighting against. So Alliance Defending Freedom, we filed a lawsuit on his behalf, and we argued under state RFRA, federal RFRA, and the First Amendment that this was an absolute violation and illegal to force Barth and his family to pay for the abortions of others. I have a bit of good news. This week, Connecticut responded to our lawsuit, and they have now added some plans in the state health exchange that now are abortion surcharge free. However, there are 4 other states that remain where families like Barth will remain victim to this deception, who will be forced to pay for these abortions and violate their conscience and their faith. And these states are New Jersey, Hawaii, Rhode Island, and Vermont. This means if you live in one of these states, you absolutely, if you are part of a state health exchange, are being forced to pay for the abortions of others, and they are directly taking a subsidy, a surcharge, money from your own pocket into essentially what amounts to an abortion slush fund to pay for these abortions of other people. There's no choice at all, and as has been mentioned very much at this point, it's all been done under a web of secrecy and deception. And as already also been mentioned, it is virtually impossible to know what your plan even entails in other states. So even if you are not living in these 4 states, you could very well be living in another state that includes these surcharges, and you may not even know about it. Which is why the work of Family Research Council and Charlotte Lozier Institute is absolutely crucial to taking down this web of secrecy and deception, so that no American should be forced by the government to pay for the abortions of others. This deception and lack of choice, it must be stopped. And we at Alliance Defending Freedom are committed to fighting for the rights of families like Barth, and so that no American will have to make this terrible choice. Thank you very much.
Thank you.
Any questions? Any questions?